In the second section of our lecture, Acoustic Neuroma, now we will talk about the clinical features of acoustic neuroma. In this, we will talk about the cochleo-vestibular symptoms of the acoustic neuroma, and then cranial nerve symptoms or features that occur as a result of involvement of cranial nerves and brain, and also what are the features of raised intracranial tension. So the age and sex of the development or the growth of acoustic neuroma, usually it's a tumor of age 40 to 60 years of age. So it's more like middle old age tumor, and it affects both sexes. Male and female are equally affected by acoustic neuroma. The cochleo-vestibular symptoms of acoustic neuroma are the earliest symptoms are caused by effect of the pressure of tumor on cochlear and vestibular nerve fibers or internal auditory artery. So as the tumor grows and it puts pressure on the different structures on the cochlear and vestibular nerve, eighth cranial nerve, which is vestibular cochlear, responsible for hearing and balance. Vestibular is for the balance, cochlear is for the hearing. So both these features are very, very commonly affected by the growth of acoustic neuroma. So here if you see, this is the tumor, then we have on top is the facial nerve, and then there is cochlear nerve. So as the tumor grows, it puts pressure on the cochlear and vestibular nerve fibers. What can occur after the pressure? There is progressive unilateral sensory neural hearing loss. Sensory neural, not conductive, because the nerves are affected. Vestibular cochlear nerves are affected, that takes the sound waves to the brain, and then it is interpretation occurs in the brain. So if the nerves are affected or damaged, it can lead to sensory neural hearing loss, and usually is unilateral progressive sensory neural hearing loss. Imbalance or unsteadiness. Balance is being affected, so person, they lost their balance, their unsteadiness and imbalance is present. Then cranial nerve involvement. What are the different features of acoustic neuroma after the involvement of different cranial nerves? So fifth nerve, which we said will be affected mainly when the acoustic neuroma grows towards superiorly, anterosuperiorly, fifth nerve is affected, which is the facial nerve. So it causes reduced corneal sensitivity, numbness or paresthesia of face. There is numbness, loss of sensations of the face as a result of involvement of the facial nerve. When the fifth nerve is affected, then when the seventh nerve is affected, there is it leads to hypoesthesia of posterior meatal wall, loss of taste and reduced lacrimation. With ninth and 10th nerve involvement, there is dysphagia and hoarseness due to palatal, pharyngeal and laryngeal paralysis. And other cranial nerves, 9th, like 11th and 12th, 3rd, 4th and 5th affected also. So these are the main features that are due to involvement of different cranial nerves by the growth of acoustic neuroma, reduced corneal sensitivity, numbness and paresthesia of the face. Then we have hoarseness, laryngeal paralysis, pharyngeal paralysis. All these are due to the effect of the involvement of the cranial nerves, the structures or muscles which are innervated by those cranial nerves, they are affected. Brainstem involvement. If the brainstem is involved, usually this leads to increased intracranial pressure, and then increased intracranial pressure have different clinical features. The brainstem, then we have cerebellum, and this is the acoustic neuroma present. Involvement of brainstem leads to ataxia, weakness and numbness of the arms and legs. Ataxia is abnormality. The walk is not balanced. There is ataxic gait. There is weakness and numbness of the arms and legs. There is exaggerated tendon reflexes are also present. Cerebellar involvement. Cerebellar is mainly responsible for the balance. So cerebellar involvement is tested by different tests, which includes the nose test. Patient is asked to touch the finger and nose. Usually these repetitive movements are affected. Knee heel test, dysdiadokinesia, ataxic gait, inability to walk straight. All these are the tests done for testing the involvement of cerebellum. Here, semicircular canals, we have cochlea, cochlear nerve, vestibular nerve. These are the ossicles. So if cerebellum is in fact involved, then mainly the tests are done to find out the coordinative movements. Coordination is affected. All these are the different tests that can check the coordinative movements. Raised intracranial pressure, if increased pressure is present, usually raised intracranial pressure leads to headache, nausea, vomiting, diplopia, which is double vision due to sixth nerve involvement. So increased intracranial pressures, as in any other brain tumors or other tumors, there is nausea, vomiting, headaches are common, and there is diplopia or double vision present. Papilledema with blurring of vision. So on ophthalmoscopy, there is a papilledema, or if edema of the pupils is present with blurring of vision. So that was all about this section. Thank you for watching sqadia.com.